Johnson. We have Eddie back with us today for a follow-up visit. Now remember, Eddie came in here with really severe lower back pain, sacroiliac pain, and radiculopathy going down his leg, down his right leg primarily. And he also had mid-back pain, neck pain, and headaches with that as well. This is his 4th visit, and I'll let him share with you after we get done how he's doing compared to then. But let's take a look at you here first, Eddie. Let's have you flex forward and then backwards. And then neutral, yep. So I know a lot of you have asked to see his follow-up video. We didn't get a chance to do it last time he was here because we were so busy. Joseph couldn't get to the camera. We're having to take him away from his duties right now to do this one, so. But you can see that his posture is a whole lot better. He's not so far forward, dips hard forward today. So we're going to go ahead and do the ring dinger on him, because that's what's helping him the most.
Yep.
Can you feel that, Eddie?
Yeah.
Yeah. Okay. There. That's it. Good. There you go, right there. And just let your legs relax and bend. The reason I bring the legs up like this is to change the angle in the pelvis and relax the spinal musculature. This, by the way, if you haven't got this yet from my other videos, is the best way to sleep is on your back with your legs elevated like this and parallel to the floor. A lot of people say, well, how do you do that? A lot of people take a couple of cushions off their couch and put under their lower legs. If you were to be at home and you were to lay on the floor with your legs elevated like this on the couch, that's how you should sleep, with no pillow. And you've been doing more of that too, haven't you? Good. Okay, nice deep breath. Here we go. I got you. Oh yeah. Yep. And yet, look at that. His reflexes are already improved. Okay, just let this go in my hand. Perfect. Good job. You're relaxing better too. That helps too, doesn't it?
Yeah.
It's easier to breathe and relax when you're not so much pain though, huh? Okie doke. Let's have you come over here on your tummy next, please, sir. First one I missed all day, Joseph.
Bad luck, girl.
It must be. Right leg is short by about 1/4 of an inch. And it gets even, that tighten up a little bit in your low back there, Eddie?
Yeah.
Yep. So we're going to adjust his SI joints first. His right one. There. Then I'm going to adjust his sacrum on the right side. Right there. Yep. See, those are still pretty painful because this is right where he's pinching the nerve at L5S1. And now I'm going to adjust his left SI joint. You can tell that's still the most tender part of his spine. There. Here's L5. L4. Just keep breathing in. There you go. There's L2. L1. Okay, just keep breathing. There we go. Good job. Okay. There we go. Okay, I'll lighten up down there so you can breathe. There we go. Okay, let's go ahead. Just lay there for a second. I'm going to go ahead and do some deep tissue work on you here with the turbonator. And just keep breathing and relaxing when I'm doing it. myofascial release is much more relaxing than that, isn't it? Let's go on your back for me now. But this is beneficial. It will help reduce those muscle spasms and myofascial pain that you're getting down there in that lumbosacral region. Okay, so I'm going to adjust your cervical spine now. Get your head up over your shoulders. Good. There. Good. Okay, slide down just a little bit this way, Eddie, right there. Good. Put your arms out to the sides. You might be asking, what good does it do to adjust his ribs in the front when he's got low back pain? Well, it does a lot of good actually, because it helps bring that whole head up and over the shoulders the way it's supposed to be. Okay, just let this go. There you go. Do you feel that in your knee and your back?
Yeah.
Okay. Same here. Just let that relax. There we go. Good job. Okay, let's hit you up and look out the window here today. Get tight in there. There we go. Okay. Okay. You're okay. Yeah. Okay. Good. Okay, let's stand over here in front of the mirror. And let's have you flex your head forward and backwards again. That's much better. Yep, look at that. Much better. Okay. Okay, now let's try that same thing again, Eddie. Neutral. Yep, head's up a lot better now. Would you mind sharing with our YouTube audience how this is done for you in the 4 treatments that you've been here from your first day?
It's been pretty good because before I couldn't sleep. Like the only way I could walk is like when I was like that, and I couldn't even walk for like 1 minute without getting like really really tired. And now I can go like probably like 20 minutes and walking, and I'm good.
Feeling better.
Yeah.
Well, you're standing up a lot better.
Yeah.
So his antalgic posture is calming down. This is only his 4th visit, so we're going to still continue to see Eddie, and we'll follow him up for you as we go along. This is your Houston chiropractor, Dr. Gregory Johnson, Advanced Chiropractic Relief, LLC in Houston, Texas. We'll see you all next time.